Hi all, Dr. Tod Anderson here, talking about a topic that affects millions of people, and that is tooth grinding, or known as Bruxism. First, with our YouTube disclaimer, this video is for informational purposes only and is not a substitute for professional dental advice. Always consult your dentist for personalized care. After treating dental patients for over 18 years, I've seen firsthand how destructive nighttime teeth grinding and jaw clenching can be. Known clinically as bruxism, this issue can quietly damage your teeth for years before you even notice, and by then it often means expensive repairs like crowns, root canals, or even tooth loss. This is a problem we can and should catch earlier. Bruxism can cause more than just chipped or worn down teeth. Many of my patients experience jaw stiffness, headaches, disrupted sleep, and in some cases failed dental work like cracked fillings, implants, or bridges. Most people don't even realize they're grinding their teeth at night until a partner hears it or they start waking up sore. Unfortunately, the cost of a custom night guard from a dentist can easily reach $500 to $800, making it inaccessible for many people. That's why at Curated Dental we've partnered with Cheeky to offer an affordable, high-quality solution. Our custom night guard kit is only $110 and includes everything you need. You'll receive a free at-home dental impression kit, free shipping both ways, and your custom-made guard is delivered within 7 business days. It's CD approved and comes with a 30-night money-back guarantee. You get the same protection a dentist would provide without the markup. Let's talk about the research. A comprehensive review published in May 2024 titled Bruxism Management by Sona J. Lal and colleagues revealed that bruxism affects up to 31% of adults and nearly 40% of school-aged children. The article defines bruxism as involuntary rhythmic jaw muscle activity, often triggered by sleep arousals, stress, anxiety, and certain medications. It's also strongly linked to sleep apnea, and in fact 50% of adults with apnea also grind their teeth. The research emphasized that oral appliances, particularly hard acrylic guards, are the gold standard for protecting the teeth, even though they don't eliminate the grinding itself. These devices help reduce tooth wear and jaw discomfort. However, soft over-the-counter guards were found to increase clenching in some users, especially if poorly fitted. Another interesting point, the study highlighted a genetic component, finding that up to 50% of people with bruxism had a family history of it. That's why bruxism isn't just a bad habit, it's often a neurological and sleep-related condition that requires clinical attention. The article also stressed the importance of interdisciplinary care, encouraging collaboration between dentists, physicians, and sleep specialists. If you've noticed any signs, like jaw soreness, flat biting edges, nighttime clenching, or your dental work just doesn't seem to last, don't wait. Bruxism can be progressive, and delaying treatment will only lead to more pain and cost. The best step you can take right now is to protect your teeth while you sleep. Head over to curateddental.com and order your Cheeky custom night guard kit today. It's simple, affordable, and dentist approved. You'll be protecting your smile and sleeping more comfortably within a week. And remember, we're not just selling products, we're building a smarter, more honest approach to oral care. Subscribe for more tips and look out for our upcoming sleep care bundles. Thanks for watching, and if you like this video, please hit that like button and subscribe to our YouTube channel. And always rinse, floss, brush.